So what have we got? 4-year-old, asthma, short of breath, medical clinic, patient currently on nebulizer.
Really hoping he's not really unwell because those jobs are hard.
Oh, absolutely. Thank God I haven't been to a death of a paediatric, but even a sick paediatric these days, having had Mia now, I just have that extra layer of, I don't know, worry as a mother, and just your heart, you know, your heart breaks seeing a sick child. So 15 months ago, I had my first child, which is a little girl called Mia, and I love her to bits. It's the best thing that's happened to me. However, I do have a whole new level of empathy for parents. Watch out, kids.
Silly. Paediatric jobs are hard jobs to do because you're not just dealing with that child, you're also dealing with the parent, and so you almost have two patients. It can make the job way more complicated.
Hello. How are you? Hi. So what's going on, Mum?
Well, he's just had a virus, and then like since yesterday, and then I slept in bed with him all last night because he vomited, and I was worried if he was vomit.
I'll take that off him just for now.
And he just more recently, like this morning, early this morning, he I just noticed that he was breathing really fast.
Panicked mum Amy rushed her 4-year-old son Luca to a local medical clinic where the doctor immediately called for an ambulance.
We brought him in straight away and put him on nebs, and he's had quite a limited response to treatment.
Now, Luca, do you mind if I listen to your breathing? So I'll warm it up first, OK, because it might be a bit cold. I like your ears.
With Luca's sister Eloise hovering close by, Risky listens to his chest.
Are you ticklish?
Yes.
The news is not good.
It is still very rattly and...
Still something going on.
Absolutely, yeah. So after assessing Luca, his chest just doesn't sound right and he's still got an increased rest rate. So, you know, this could be anything, but this could even be the first signs of asthma. We'll get him to the right place and then they'll take care of him, OK?
If asthma is unmanaged, it can have serious consequences. Luca needs to go to hospital for a diagnosis.
We always second-guess ourselves as mums, and I definitely at that point was feeling guilty about it. I should have done something earlier, or I should have taken him straight to hospital, but I didn't want to be that mum that was clogging up the waiting room with something that wasn't urgent.
All right, we'll put your racing car harness on. Amy, she's shattered. She's obviously upset about what's happened, and instantly as a mother, I just want to give her a big hug. So there's no wheeze, but I reckon it's more chest infection. Yeah, because it sounds like, I don't know if you call it bronchi.
Yeah.
Looking after your kids, keeping them safe, it is overwhelming, and when your child's not breathing properly, it's actually very frightening. Hearing the word asthma was quite shocking, and my mind was racing a million miles a minute. It was more serious than what I'd realised.
Have you been in an ambulance before, Luca? No. No, first time. It's a bit exciting, isn't it?
Risky and Nicola are preparing to take Luca to hospital. The 4-year-old is struggling to breathe, and the paramedics are worried this could be the first signs of asthma.
You're so brave. Hey? Yeah. How does your breathing feel? Is it still hard?
You're terrible. I didn't do anything wrong.
No. Hey, these things come on really quickly, OK? So don't feel terrible at all, OK? You've done exactly the right thing. Poor Amy, she's still beating herself up over not taking Luca to the hospital earlier, but in these cases, you've got to do what feels best at the time as a parent, and she's taking him to the doctors. You know, what more can you do?
Are you hot or cold? He said cold.
Cold.
Eloise is a wonderful big sister. I have to say she's really caring, nurturing. She really does look out for Luca, and they really care about each other a lot.
Bye, Mum and Luca.
Bye, sweetie. Thank you for helping so much. Bye.
Dad Darren's now arrived to take Eloise to school, so Risky and Nicola can get Luca checked out by specialists at the Austin Hospital.
You just had your birthday, Luca.
I'm 4.
You were 4. Did you have a birthday cake?
Yes.
Yeah, what was it?
I think it was a chocolate one.
Oh, wow. Chocolate's my favourite.
Usually Luca is just a very energetic 4-year-old. He's really cheeky, sort of mischievous personality, and he's very funny.
I bet it was delicious. Yeah.
But then when you see him like that, really made me quite scared and worried.
There'll be no relaxing for Amy until the doctors can tell her just how serious Luca's condition is.
Both of my children are just the absolute most important thing in the world to me, and to see them in distress or unwell like that, it really does break your heart, and you just do anything to make them well again.
All right. You're so brave. Hey? Yeah.
4-year-old Luca was taken to emergency after a cold turned into serious breathing problems. After being kept in for observation, it wasn't long before he was back to his usual energetic self. But doctors did confirm that Luca had suffered his first asthma attack. Mum Amy is now prepared with a medical plan.
What about that one? That's a good one. Does that work? It did give me reassurance to know that I would have the medication at home if it happens again. I think I've gotten over my mummy guilt and just happy to have a healthy little boy back. Are you sleeping?
Emergency services.
My daughter's nothing in it.
Okay, tell me exactly what happened. She's not breathing, is that right?
Yeah, I noticed vomiting. I just went in there. She's breathing really funny.
A frantic mum has rung emergency services after finding her 2-year-old daughter unconscious.
We'll get some help organised, so just take a deep breath.
The Melbourne-based air ambulance is being dispatched to the caller's location, 190 kilometres away in the Victorian country town of Shepparton.
She's not awake. Her teeth are like closed shut.
Okay, is she breathing?
She's slightly breathing. Can you please hurry up?
So, ma'am, we are getting some help organised for her.
Micah flight paramedic Matt and his crew are on board.
Not 100% clear on what's actually happened at this stage with regards to how the child's become unwell. A crew on scene, they're actually already gone ahead and given the child some drugs and put them in an induced coma and put them to sleep and put a tube down the throat to support their breathing. The ultimate place for this child to be at, rather than being at a rural hospital, is to go down to the Royal Children's Hospital.
Helicopters are called out for life-threatening emergencies that can't be dealt with at local hospitals, with crews responding to more than 2,000 each year.
The work that we actually do is considered to be the sickest of the sick patients. When you get dispatched to a paediatric case, there's always things that go through your mind thinking, oh, is this similar to the age of my children? And, what if this was my children as you get dispatched to it? So it automatically increases your heart rate and your anxiety about the job that you're about to go to.
After 30 minutes, the helicopter arrives at Shepparton Airport. The local paramedics are already on the tarmac, standing by for the Micah helicopter team to arrive.
Hey mate, how you going, all right? That's the way.
Inside the ambulance, 2-year-old Mackenzie is now in an induced coma, with the paramedics controlling her breathing.
So Mackenzie has been well, no problems up till this morning. Mum's found her, she's had vomit over her mouth, over a pillow next to her and breathing funny. So she's done about 5 compressions of CPR or so.
Sure.
And we've arrived, she's got a pulse.
Righto.
Mackenzie's distressed parents and family friends are standing by, helpless. For Mackenzie's mum, Bree, this morning there were no signs of the nightmare ahead.
Went off to playgroup. She had a great morning, and then we came back and she had lunch, and then it was just a kiss goodnight and she went to bed.
She's gonna have a listen.
Then, as I normally do, I always go in and check on her. I noticed that she was doing this really strange breathing. I went closer and then there was vomit over her pillow. And she was all floppy and I was just like saying, come on, wake up, wake up. And yeah, she wasn't waking up. Petrified. Petrified that, the worst was going to happen.
We've sucked her airway out a couple of times now and she's got a pretty good airway, but I've had to really keep the ventilation up to her to bring her end tidal down.
She's got blood pressure, GCS 4, decerebrate posturing with eyes deviated to 10 o'clock, roll to the right, but no seizure activity.
And there's been no stiffness other than the decerebrate posturing.
Absolutely.
The guys at scene mentioned decerebrate posturing, which indicates that there's a bit of pressure onto the brain, or the brain isn't functioning in the way that it normally should.
So if we can just start transferring to our monitor, and that's it, just a little bit of elevation there.
It makes us concerned that maybe there is a lack of oxygen to the brain or there's a bleed in the brain. So it heightens our concern about what's going on with the patient. Depending on the degrees of bleeding that people can have in the brain, people can have a very bad outcome from that, and obviously it can lead to death.
Let's get young Mackenzie out of the truck here and onto our stretcher.
A flight team are preparing to airlift 2-year-old Mackenzie from country Victoria to Melbourne after she was found unconscious at her home.
1, 2, 3.
The cause is still unknown. Mackenzie's dad, Dean, was at work when he received the news from his wife, Bree.
Bree's call, I wasn't even going to answer the phone. Something made me just answer it, and then just pure panic.
So she's not breathing for herself at the moment. We've got control of all of that, and the heart rate and blood pressure's all good at the moment.
Okay.
In my guts, I just felt sick. Walking around the house as I was working on it, and I was looking at where she does paintings and on her little table, and she's got like her little crayons, and I'm like, how am I ever going to come back to this house to see this if she's not going to be with us?
It's Mum Bree who'll fly with her only child to the Royal Children's Hospital.
It'll be about a 30-minute trip back to the Royal Children's.
It is extremely hard to let your girl be just taken away from you, out of your sight. I knew she was alive, I knew she had a heartbeat, but I didn't know if that was going to continue. It's like I gave her like a goodbye kiss in the helicopter to never be seen again. So.
Taxi forklift.
It just breaks your heart.
Beautiful afternoon out there, isn't it?
Like a fluffy ocean.
Yeah, very much so.
As the heart-wrenching journey to Melbourne gets underway, paramedic Matt attempts to reassure Bree.
Everything is working okay, heart-wise, oxygen-wise, and all those sorts of things. It sounds like she's had a seizure of some sort and has vomited, but that would be my interpretation.
A lot of children have seizures, and they can have seizures for many different types of reasons. When someone has a seizure, they've got disorganised electrical activity going on in their brain, so we try and give them medicine which will sedate them and calm them down.
They'll do a CT scan of the head and work out that everything's going on okay there.
There's lots of other things that it could potentially be, but I'm hoping that it is a seizure activity that's going to resolve, and Mackenzie's going to come out of this okay.
She's never been in a helicopter before, so she doesn't get to appreciate it. Oh, well, you'll be able to tell her all about it afterwards.
Mackenzie is just a joy. She's our world. I was just thinking, we can't be losing her.
She's got the painted nails and everything.
Yeah, we painted them this morning.
Nice. I've got 3 young kids as well. And, you know, when you look after young kids that are a similar age going through nasty accidents, or you just manage looking after the patient at the time, but it's not until you walk away that you actually think about things after. It hits home.
Kids are the worst. I hate seeing kids injured in accidents. Anything that involves children getting hurt is probably the ones that I come home and get upset about. So they're the hard ones to deal with.
Just looking at her with the tubes in her mouth, my mind was racing of all the things that could happen and what's her future going to be like if there's a future. Yeah, I wasn't too sure what the outcome was going to be.
was a sigh of relief as we actually landed at Royal Children's Hospital. You'd just love to give a reassurance to say everything's going to be all right. But I can't give that 100% guarantee that everything is going to be okay. I think given that sort of circumstance, I would be a blubbering mess. It's not something any parent should really have to go through in their lifetime.
And it's been 1 week since 2-year-old Mackenzie was found unconscious and airlifted to hospital.
The last time I saw Mackenzie was as I handed her over to the hospital staff at the Royal Children's Hospital. This is one of the cases that I want to know that she has a positive outcome. I want to hear that everything's okay.
1, 2, 3.
Yay! The doctors told us that it was a possible seizure, what had happened, but there was no injury to the brain. Her chest scan was clear. All her bloods had come back normal. So it was positive in that way, but then it was also, well, why did this happen? And will it ever happen again?
Hello, Mackenzie. How are you? Do you remember me? I guess you don't remember me at all. I've got a little surprise for you. Oh, wow. That's a big teddy.
While Mackenzie's been cleared of epilepsy, what doctors can't tell Bree is whether her little girl will suffer any more seizures.
Can I have a hug, please? Oh, thank you.
Now that we're back home, we've become these like helicopter parents. I crept in on her the other day when she was having her day nap and I must have made a noise and she kind of looks at me and she's like, Mum, what are you doing? And I was like, no, it's fine. You're fine. It's all good. Go back to sleep.
Oh, and another step.
Today, Matt's going to get Mackenzie airborne again. And this time, she'll remember the trip.
Now, if you look over there, behind that crane is the Royal Children's Hospital, and that's where we flew you to in the helicopter.
The paramedics were fantastic. By far the worst moment I've ever been through, but surrounded by the greatest people that we've had the pleasure of meeting.
We're just, forever thankful. So thank you so much.
The work they do and how they do it is just mind-blowing. It takes a special breed of person to do what they do. We owe our daughter's lifetime.
Emergency services.
My son has been wheezing since Friday.
Are you with him now?
Yes.
How old is he?
He's 16 months.
As luck would have it, the job Mike and Jamie are off to next is a child in need of help.
Is he breathing?
He's breathing very quickly.
All right, mate, we are off to a 16-month-old male who apparently is short of breath and wheezing. Yep. They've been wheezing for 3 days, and apparently it's worse today.
Pediatrics are always the worst. Anytime we get dispatched to kids with breathing difficulties, we are quite worried because they can be quite fragile and change very quickly.
Okay. I'd say that's probably our patient. That'll be the one. Hello. How you going? My name's Jamie. I've got Mike with me. Is this that little guy that we're here to see?
Yes, yeah.
What's his name?
His name is Pars. My name is Pino.
1-year-old Pars has been in and out of hospital for the past 3 days and is already being medicated for a nasty case of croup.
We went to hospital on Friday. They gave him dexamethasone 2 ml. So he did not improve at all.
Yeah, right.
Croup's a very common viral illness that affects children. It makes their whole upper airway swell up. They often get this barking cough that most parents will know. Usually they get better after a week or two, but sometimes they can be really sick.
So what's happened this afternoon?
So he had a little nap. When he wake up from his little nap, he was breathing problems.
Yeah. Okay, so just struggling to breathe, wheezing and stuff. Yeah, okay.
Really.
I'll very quickly pop this in his ear if you can hold him still. Oh, sorry, Bubba. Great. 38.9, so he's a bit warm.
After our assessment, we haven't really found anything sinister going on, but Pars has obviously been dealing with croup for the last couple of days, so he definitely needs to come up to hospital and get seen by a doctor.
All right, whenever you're ready, we'll start heading off, all right?
Sure.
It's a precautionary visit, but it's Pa's third trip to hospital in as many days.
So we'll pop him on the bed there.
And he's not happy about it.
Oh, you're okay. Poor little thing.
It really breaks your heart to see a toddler so distressed, but I'm going to try my best to make sure he's comfortable.
What we'll do, I think we'll swap back over and I'll just keep an eye on him, okay? That's all. I think he's...
1-year-old Paz is about to make a precautionary trip to hospital for his croup.
I'll give the sippy cup back to him. Here you go. Hey.
Since getting into the ambulance, not even Mum has been able to settle the unhappy toddler.
You're okay.
But Jamie thinks he's got what it takes.
Let's see, we've got some bubbles.
Yeah, give that a go. They smell like oranges.
Look at this.
Oh, I absolutely love kids. They're quite easy to sort of entertain. And to be honest, I consider myself a bit of a child whisperer.
Oh, it's not even working.
Yeah, it's quite hard, hey?
I think your bubbles aren't working at all.
Well, maybe it's the operator.
Jamie likes to think he's a bit of a baby whisperer, but in all the time we work together, I don't see any evidence of that. He means really well, but, you know, he doesn't bring his own bubbles to work like some other ambos.
Moving off.
You know what? You need a balloon animal. Let's get a balloon animal happening.
So there's different things that I always try and do for kids to try and cheer them up. I like to blow up a glove and draw an elephant. He had no bar of that.
Let's try the pen torch. Ready? I'm not that scary, am I? What if I do this one? Oh, poor little thing.
It was non-stop crying the whole way to hospital.
Why don't you like me?
Jamie's a very good operator, so it was funny to see him doing every trick in the book and nothing is working on him.
Is there anything that usually calms him down when he's driving? Only Mummy. He's a mummy's boy.
Fortunately for everyone, the team has now arrived at hospital where Paz will have his croup reassessed by paediatricians.
We're here now, buddy. We're here. Let's get you into Mum's arms. How does that sound? Hey? Look who it is. Look, it's Mum. Look at that.
Silence at last, but I totally get it. When you're sick, all you need is a cuddle from Mum.
Since his trip to hospital, little Paz has made a full recovery from his croup and hasn't needed any further medical interventions. But Jamie is still working on his balloon skills, just in case.
Oh yeah, power feed. I like it.
I'm getting hungry again.
When are you not hungry?
When I sleep.
Yeah, but do you wake up hungry?
Yeah.
Yeah. So it's just you're more tired than you are hungry.
Yeah.
In the northern suburbs, Jamie and Mike are dealing with a very common paramedic problem. They're overdue for their meal break.
I think that's probably one of the hardest things of the job is you're not always guaranteed to have your meal break on time. You can go a 14-hour night shift and not get food until you're a 12th hour into the shift, and you just get so hangry and so tired, and you can't wait to sink your teeth into anything fattening.
Oh, I really want to eat my Thai food that is at Preston.
You got Thai, what'd you get?
Pad See Ew combination. Lately I've been doing the cheeky, go to the Thai food place, get two things, pretend they're not both for me. Yeah. You know, typical grown-up stuff.
But once again, food will have to wait.
Emergency services.
We have a student with a fractured left arm.
Is it an obvious deformity?
It's quite nasty. It's actually disfigured.
Okay, help's been organised for him now. Stay on the line. I'll tell you exactly what to do next.
So we're going to a 12-year-old male who has fractured his left arm post the fall.
The still hungry Mike and Jamie have now been diverted to the primary school to assess the student's fracture.
Park behind the white car.
I think staying calm in the job, it's really important. I think some people are just really good at it. Other people, you know when they're stressing. What's the little tacker's name?
Max.
Max. Ah, no dramas.
Just through this door.
Beautiful. You're essentially like a duck on water. You're paddling like crazy underneath, but you're just calm on the surface. And it's really important to be that calm because if we're stressing out, the patient's going to stress out.
And Max's mum got staff.
Hello.
G'day. And this is Max.
G'day, Max.
Hi, guys.
Oh, what have you done, mate? What have you done to yourself? You all right? It's a bit sore, is it? Yeah. Poor thing.
Walking in to see Max and I kind of come around and have a look and, oh, his arm shouldn't be bent like that.
You were just running around in the yard, were you? Yeah.
I teach prep here.
Yeah.
So I'm lined up with my prep grade. The deputy principal said,
There you go.
Leanne's mouthing. Max is right.
Oh, no. Max's arm looks really nasty and I think he's broken a couple of bones. He's definitely done some serious damage. You're very brave, you know that? Very brave. You're braver than me. I'm a little sook. I'd be crying if I was you.
Mike and Jamie have been called out to help a 12-year-old student with a shocking fracture of his left arm.
Hey, do you want to pop your finger in there for me, champ? Good job. He's done a number on himself.
Poor Max fell over in the playground at his primary school.
Blood pressure was 113 on 72, by the way.
His mum, Leanne, is a teacher there and was immediately at her son's side.
All right, Max, what we'll do, we've got a little medication that we'll spray in your nose and hopefully it makes you feel much better, OK? How does that sound?
Very good.
Very good.
Excellent. This is just a strong painkiller. It's like a synthetic version of morphine. It won't knock him out or anything. It can make him say a few silly things, but it's a really good painkiller.
Do you want to just lean your head back just a little bit? All right, ready? 1, 2, 3. And one more. 1, 2, 3. There we go. Beautiful. It might dribble out a little bit. Just sniff it up. Fine. Lovely.
How long does it usually take for the painkiller to...
Usually pretty quick, but you've done a decent job, so it might take a little while.
With pain relief on board, the boys can now put a splint on Max's arm.
All right, so I'm gonna hold on just to your fingertips and I'm gonna take the weight of your arm here. So I'll do the very, very little moving. Oh, good. And if you can help, beautiful. Yeah.
Sorry, champ.
Very brave, Maxie.
Sorry, mate. I think that's
You
probably
are
the
a
best
champion.
spot. Look at that.
And I'm gonna hold underneath there. You're doing great.
Will I still be able to play PlayStation?
Oh, of course.
Yeah, mate. What do you play on PlayStation?
Fortnite.
Oh,
Is
nice.
it good?
Yeah.
I haven't played it yet.
Max is a champion. He has his priorities right. Every bloke, no matter how old we are, we like a bit of PlayStation or Xbox, so I can appreciate that.
That's a good position there, Jamie. You happy?
Yeah, I'm happy with that, mate. Is that okay? Yeah? Oh, beautiful. He's not choking you, is he?
No.
No, he's doing a good job. All right, mate. How are you on your feet? You okay? Do you reckon you'll be able to walk? Yeah? You all right? Beautiful. You're taller than me.
Some kids are braver than I am, I'll be honest. Like, they can be amazing and they kind of go, oh, I just want to keep playing. My arm's hanging off at a weird angle. I just want to keep playing. They're great.
I am happy to roll, mate.
Cool. Everyone's all buckled up?
Yeah.
Excellent. Very good. Off we go.
Do you play any sport, champ?
Footy.
Footy. What position do you play?
All around, sometimes on wing, sometimes in the forward,
Ah,
sometimes
nice.
in the back.
What's your favourite position?
Probably the wing.
Yeah.
And Dad's his coach.
Oh, there you go.
When I rang my husband, he goes, oh, there goes his footy career.
Nah, you'll still be able to play footy.
In a little while.
Yeah, in a little while. Yeah.
Max is starting to feel a lot happier.
Smile. Give us a thumbs up.
He'll now be taken to X-rays to find out just how bad the damage is to his deformed arm.
Yeah, good. Here we go. A few bumps as we come out. It's like a transformer, this thing, when it makes sounds.
For this 12-year-old, it could be a long, impatient wait before he can resume his footy career.
And down we flop.
Poor little Max. It might be a while before he's back playing video games or footy, but hopefully we can get together one day for a kick. Absolute trooper.
As for brave schoolboy Max, it's been 2 months since Jamie and Mike were called to his school after he badly injured his arm when he took a tumble in the playground.
G'day, Max.
Oh, hi, Jamie.
How you going?
Today, Jamie's dropped by to check up on his little mate's progress.
Good to see you out and about.
Yeah.
How's the arm going?
It's going very good.
Yeah? What did the doctor say?
They said that I broke my ulnar radius.
Ouch. Poor Max. It turned out that he broke his arm in 2 places and he was in a cast for 7 weeks, but it's good to see that his spirits are still high.
Yeah, this is for you.
Oh, thanks, mate. You didn't have to do that. Dear Jamie, thank you for taking great care of me when I broke my arm. From Max. Thanks, mate.
It's okay.
Now, how about you show me how to kick the footy?
Sure.
Sounds good. We don't often get to see our patients, so to catch up with little Max and for him to write us a thank you card just means everything to us. Max is an absolute legend. Wouldn't even be able to tell your arm was broken, mate. Yeah, it's all yours. Go.
Thank you.
Big kick. You can teach me a thing or two, mate.
Emergency services. Fidel from Northern Victoria. We've got a child locked in the vehicle there.
Child locked in a car at a kindergarten.
Why do people still do that? Don't lock your children in cars.
Last year, there were 1,700 calls to Victoria's emergency services reporting someone locked in a vehicle. 90% of those calls were for children.
It says that she's been locked in the car for how long?
10 to 30 minutes.
30 minutes, like as if you don't know that your child's outside in the car. You're at a kindergarten, just bring her in.
People don't understand how quickly the temperature rises in a car. So if it's just seems like a mild 25-degree day outside, if that car's in the sun, within minutes that car could be 40, 50 degrees. And that child inside is sweating, becoming dehydrated, and all of a sudden everything starts to shut down.
Put yourself in a car, turn the air conditioning off, put your windows up and sit there for 10 minutes. Tell me how hot you get.
In the past 10 years, in Victoria alone, 5 children have died after being left in cars.
Is it down there, is it?
Here's Orion's head.
Down there?
Tension is building in the ambulance as the crew search for the right location.
It's a kindergarten.
No, that's a primary school.
That's a primary school. We're looking for a kindergarten, aren't we?
Yeah.
Oh, no. Where is it? Oh, back that way. After you guys, though. Thanks.
The momentary confusion is over, and the team are now only minutes away.
It must be the continuation of that street that we just went down. That's the frustrating part about the GPS and why the Melways is better.
Time is a critical factor in a case like this.
This poor mum, she must be absolutely beside herself.
Anyone locked in a car is an emergency, but children can't regulate their body temperature as well as adults. So a trapped child is a priority.
I'm Taz.
I'm Shannon. How are you?
Hi, Shannon. That's Amanda.
Who's inside?
Charlotte. And there's a Rottweiler in the back, and she's friendly.
Not only is 2-year-old Charlotte in the car, but so is Minx, the family pet Rottweiler.
How long she's been locked in for, do you reckon?
20 minutes, maybe longer than that. Maybe 25.
Charlotte's mum, Shannon, is panic-stricken. With her keys in her bag, inside the car, there was nothing she could do.
I put Charlotte in the car and the car locked itself on its own. Looking around, wanting to smash the windows, just absolute panic. I can't believe I've done this.
So after chucking my tantrum and being quite verbal about how I feel about mums locking children in cars, I am absolutely eating my words. I'm feeling like the worst person. Thankfully, she doesn't know what I was saying in the car beforehand.
She's active still. I can't really see much.
Amanda does her best to assess Charlotte's condition from the outside as the team work quickly to break into the car.
She's actually quite upset. She's crying. For us, that's a really good sign because at least she's breathing.
Oh, there you go. It's open.
They're in.
Oh, hello. Can I have a cuddle?
Oh, okay, fair enough. She might.
There we go.
This is normal. This is good.
You want a drink?
Have some water.
Uba. Yeah, Katus?
Charlotte, do you want to go to Mummy or do you want to stay with Uncle Taz?
Do you want to go to Taz or Mummy?
If a child is inconsolable, that can be an indication that the child is in pain or that there's something else that's not quite right. So Taz and I are quite keen to do a bit of an assessment on Charlotte to make sure she's okay.
We still want to quickly check her temperature and heart rate, if that's okay with you.
But Charlotte's not the only passenger to be rescued.
Can I check on the dog?
I'm automatically thinking, oh my God, is the dog okay as well? We know that the child's fine, which is great.
How about you?
Hello.
You are stunning.
She's a beautiful girl. She loves people. She's very happy to have a pat and a cuddle, and we're just happy to make sure that she was fine.
With Charlotte safely back in her arms, a very relieved Shannon knows all too well how lucky she is.
So I dropped the older one up at kinder, walked up, put her in the car, and put my backpack in the front seat, closed the door, and it was locked.
So you didn't even leave her? Like you put your bag in the car and it just locked?
So there's something faulty now with that.
Yeah,
So
I would get that double checked, definitely.
Shannon was confronted with a situation which could have been absolutely horrendous and could have definitely ended differently. However, thankfully, we're all good and Charlotte's just fine.
There you go, and look at the number we're gonna get there. 150 is good. So she's within normal range. So she's 100%.
Yeah.
But before Charlotte can go home, Uncle Taz has one more surprise.
You like it?
Yeah, it's great. It's better than the first
The red one is
one.
better. Charlotte's happy.
Yeah, she's very happy.
Yeah.
Happy mum. Happy bub.